Yo, what up, what up? I'm back at you, everybody. About to get into today's health tips. Of course, it's Motivational Monday, and I definitely got to give you all some health advice and all that. Today, we're going to learn a little bit more about diabetes. This was inspired by the live stream that happened on Thursday of last week. Yes, so we got a little bit into that topic, and we talked about how it was a silent killer and all that stuff. So today, we're just kind of going to do a little overview of what diabetes is, some of its risk factors, some of the signs and symptoms to look out for, and also some of the diseases that you may be at risk for, and a couple of little lifestyle changes that you can do. But we already know what that is. All right, so here we go. Let's see, type 2 diabetes is pretty much the insulin resistant diabetes. It's where your liver is pretty much producing too much glucose and storing too much glucose while also regulating the glucose. And pretty much your pancreas can't keep track of it, and it's not producing enough insulin. It may have started out producing enough, but then somewhere over the time frame, it just wasn't able to keep track, and so now you have this overproduction or hyperglycemic effect and everything going on inside of your body. And we want to make sure that we take heed to this whole diabetes thing. If you've ever been diagnosed or something, by checking your blood sugars and stuff regularly, also going your every 3 months to get your A1Cs checked. I know a lot of us like to cheat and stuff. I got an aunt and stuff, she likes to cheat on her regimen and everything like that, but she needs to understand that she's putting herself at more at risk for all these other different types of health concerns and stuff. Some of the risk factors that we want to talk about is the weight has a direct correlation with how well your body absorbs insulin. So we definitely want to make sure that we are, keeping our weight at a healthy level and everything. And if we do have some extra pounds and all that, we want to take progressive steps to make sure that we're changing our diet and we're exercising a little bit more to reduce those risk factors. Also, inactivity, like I just said, you want to exercise a little bit more because lazy has never been good for anybody in our health. And like I say, when you're in bed, you're dead. You're not good to anybody, not even yourself, and all that. Family history, excuse me, family history. Your mom and dad or somebody in the family may have a history of diabetes, so that may put you more at risk. Also, your ethnicity, minorities, African Americans, Indians, Hispanics, and things. We are more at risk for having diabetes as well, especially with our diets and the things that we eat with the different soul foods. And some of us eat a lot of rice and stuff that turns into that are carbohydrates that pretty much turn into sugars and stuff and gets to storing. So, like I said, also, age is a risk factor. Also, if you were being pregnant and was diagnosed with gestational diabetes and everything, you could very much so be at risk for developing permanent type 2 diabetes. Also, if you have polycystic ovarian syndrome, also high blood pressure as well. That's one of them. We talked about that in one of my very first health tip videos. Please go check that out. And also, if you have overproduction of or an increased level of cholesterol and triglycerides in your system, I also did a video on that. Please go check that out because those have a direct correlation with diabetes and what it's doing in your body and stuff. Some of the signs and symptoms that we want to look out for is you may be having increased thirstiness, or also you may have an increase in urinating as well as hunger. You may be a little bit more fatigued than normal because you have too much sugar in your body. They say it gives you too much, and they say it gives you energy, but too much of anything can not be good for you. Also blurry vision because the sugar is now putting pressure on those capillary walls and stuff, and so therefore you could be experiencing some type of blurry vision or blindness onset and everything. Also, cuts and bruises may be slow to heal and everything. That's because sugar is not a healer, it is a killer. And so we definitely want to make sure that we're decreasing our sugars so that these cuts and bruises can heal on time and properly without any type of infection or complications and stuff. Also, tingling and numbness in the hands and feet, those are also telltale signs as well. that you may be experiencing some early onset of neuropathy and all that, which means you may be losing sensation and stuff in your fingertips and stuff, and therefore you may put yourself more at risk for getting cuts and bruises because you can't feel different things that may be happening to you, or you may be stepping on and stuff. So, like I say, those are some of the signs and symptoms that we want to definitely look out for and all that. And also the diseases that put that you're at risk for is like cardiovascular disease, nerve damage, like I said, neuropathy, that's a big part of it. Kidney damage, eye damage, also foot damage, skin conditions, hearing impairment, Alzheimer's. Like I say, the list can go on and on and on. Like I say, if you are a diabetic, or you are knowing somebody that is a diabetic, please make sure you encourage them and encourage yourself to make sure you're taking your regimens and stuff on time, because you could be putting yourself at risk. I know a lot of times diabetic people like to have little cheat days and things like that, but and try to increase their insulin and stuff, but you're pretty much not doing yourself no good. You want to make sure you stay on that regimen and keep that insulin in your body, and also keep those sugar levels down, because you could really be doing some really big harm to your body, and also causing something else to spin off from that, to where you might be having to take another type of medication. So therefore, just understand, with every action comes a reaction, and everything you do has a consequence. So be mindful of that whenever you're indulging, you're out here having that extra piece of cake or a piece of ice cream or that Snickers or something, because you could be putting yourself at risk for quote unquote death. I mean, I'm sorry to put it to you plain and bluntly like that, but it just has to be said like that. So like I said, make sure that you are doing everything that you need to do. Change those lifestyle habits. You may need to decrease on all the different types of carbohydrates you're putting in your body and stuff. You may want to exercise more. Also decrease those fats and triglycerides and trans fats and things. Therefore, your body can be able to absorb the insulin a lot more better, and you'll be able to have a much better handle on the whole diabetes type 2 disease and all that. And hope you all enjoyed this review and this health tip and all that. I'll be coming back at you with part 2 of this. We're going to be talking about diabetes type 1 and also gestational diabetes, and I'll do another one on diabetes insipidus. All right, I love you all. Thank you all for just joining in with me. This has been Mike Hardy on Mike Hard TV, coming at you with health tips today on Motivational Monday. Please hit the subscribe button if you have not already. I love talking to you all. Love you all. Bye.